Let's log into our Asprodental cloud practice management software and view our schedule for the day. You can log in here from anything that can open up a web page. This is on my laptop, but you can do the same from an office computer, your phone, tablet, iPad. Anything that opens up a website will be able to pull up Asprodental. Once we log in, we have our schedule for the day with the numbers on the bottom, your production that's scheduled, what's been completed so far today, how much has been collected, how many hygiene patients we have, how many new patients, and how many in total are scheduled for the day. These numbers update in real time. So as you add appointments, move things around, they'll update so you have a better idea of where you stand as the day progresses. Let's look at Samantha's appointment. We can drag and drop her to another time column very easily like this, change the length of her appointment. We can also move her to a different day by flipping over to another day and then drag and drop her back onto the schedule. We can even move her to a different location. So up on the top left where we have our different locations, you can flip over to another location that has more openings and put your patient on the schedule for there. But let's bring her back to our first location, Madison Circle, and say she has the entire week off. We can check for the entire week to see where our openings are and put her down on a Thursday, for example. Now, if Samantha tells us that Thursdays are her only days off, you can also check, let's see, all of the Thursdays in the month, which ones have an opening, and you can move her between each Thursday of the month. But let's bring her back to today, and we will get her back on to the schedule. In Samantha's appointment, we have a few visual cues of what's going on. The confirmed or unconfirmed, you can see over on the left side here, checked in, different statuses of the appointments. The red plus sign means that she has medical alerts. This badge will show whether or not her insurance is active. And these little icons that can be set up by the office. In the settings, you can choose what they mean and pick different icons in their descriptions. In the appointment itself, we have her due for today based off of the insurance coverage, allergies and conditions, the notes that come from her profile, and this note specifically for this appointment. We have what insurance will cover and what she's supposed to pay us for today's visit. She's coming in here with Dr. Hermione, and there's a log of when the appointment was created or edited. If the reminder is sent to her via text or email, and if she were to confirm online, you would then see that confirmation come through with the date and time that the patient confirmed. The office can also click on confirm now, and then you would see the history of when it was confirmed there. So let's go ahead and check her in. Upon check-in, we are taken to the patient's profile where we have the same notes that show up in the appointment, the allergies, conditions, a history of comments or notes that you can do for the front office team. We have our consent forms in the middle. All of the standard consent forms from TDIC, the dental insurance company, are included here, and you can select them, toggle back and forth to view, put in a tooth number, and send it to the patient to sign via text or email before they come in. This saves your in-office time so that by the time the patient actually comes in, you'll have all of the forms signed and all you need to do is get the patient back. It saves a ton of in-office paperwork as well. Let's go over to her documents because everything that gets signed will save itself automatically into the documents with the patient's signature. That way you don't have to print or scan anything and save yourself some of that busy work and handling paperwork time. On the Documents tab is also where you can import anything from the computer if you have reports from other offices, referrals, things like that. Anything that the patient sends you via text message also gets saved as an image directly into the documents. So up on the top right where we have our message bubble, we have the text conversation between our patient and us, and anything that she sends via text as a photo saves back into the documents like that. But the entire text message thread is also saved indefinitely as part of the official patient record, so you have the whole conversation there as well. Now back on her profile, we also have the patient intake form, which can be sent ahead of time. It can also be scheduled to send out a couple days before the appointment if the patient has not filled it out within the past 12 months. That's the default setting, but offices will do 6 months fill out period. You can do a week before the appointment, 2 days before the appointment, however long you would like to have it be a buffer time. That way, when the patient comes in, all of their health information, their correct address will be inputted for you already. If the patient has previously filled this out, all of their responses will be there. You could put in explanations if you need to. Any additional allergies that are newly added can be updated by the patient themselves as well. We are now pretending to be the patient and signing this form. So we're acting as Samantha, signing this in person if we have not done it prior to her coming in. Once it's signed, you can see all of the updates on the health history tab, and the office up on the top right can also make their own edits and put in any notes there, and a history up on the top left of all of the edits and when they were made and by whom. That way we have a log of the changes. Now moving on over to the chart. Here we have the allergies and conditions that follow the patient around. We have our odontogram in the middle with the view of perioprobings as well. On the bottom left, you have a list of upcoming appointments and what procedures are included. In the middle, we're going to start putting in some recommended procedures in just a few minutes. And on the lower right side, we have your clinical history, all the clinical notes from past visits. And this is also fully searchable. So you can look for any notes that you had typed in using the body text of the note right there, which is really nice because you don't have to read through all of the notes if you remember some keywords. Asprodental is the only practice management software that has a fully one-page chart in this way, where everything that you need is at your fingertips in this clinical dashboard. If for Samantha, let's do the select teeth mode, and we can say if any teeth are missing like this. If she came in with any impacted teeth, you can mark them like so. If there are any teeth that are implants, you can mark them like that. That way we set the tooth map to resemble what's going on in her mouth at the time that she comes into us. Then we can show the perio probings from her past visits. You can either record new measurements or copy the measurements from the previous date. For recording the measurements, we have voice perio as well. We do this. We can say what the measurements are, read it out loud, and the measurements will be inputted directly in. But I'm just going to, for this demo, type in the measurements using my keyboard. So that goes all the way through your gingival marginal recession as well. Clinical attachment level calculates itself based on the perio and recession. Then you can mark bleeding per site. You can do suppuration, mobility, furcation, like that. If we skipped on the last step, marking our impacted or missing teeth, we can do them here. You can also put in notes like that. And then close up here. Everything is automatically saved, so we can view or collapse to save some space. And then let's add some treatment items that we're recommending to the patient. All of the recommendations for entering in treatment, the idea is that anybody working in the back, even with minimal dental coding experience, can figure out which procedures to add at a glance. So if we click on the tooth, the doctor says it's an MO filling. We can select the surfaces, and we are given suggestions of what codes to use based off of the posterior tooth selection with the two surfaces. So let's do that one more time. Number 19, we do an MOB. You can see all of the codes here in the expanded view, but if we change the number of surfaces, the codes that are available to us change as well. Anything that is done frequently, you can bookmark so that it shows up on top like this or not. And the bookmarks are office-wide. That way everybody's on the same page on which codes we use most frequently in the office. I can move these two to first priority with a simple drag and drop like that. For a crown and build-up, same thing, pick the tooth. The crown and build-up codes are available there. Nice and easy for shortcuts. If you don't know the codes, you can also search them for the word build-up, for example. If you don't know the procedure code, that's available there. And we can grab these 4 procedures, move them to second priority. I can also rename them if I want to. Instead of first, second, we can call them fillings, crowns, things like that, or we can say after whitening, before Invisalign, different categories to customize your treatment plan for this patient. And same thing with perio measurements and scaling and root planing. We can add those there and move these over to third. Once we have our procedures in, we can present them to the patient. So maybe these 4, if we want to present those items, we can present the treatment plan. We can change our what is shown, and we can show insurance coverage, the fee and the allowed amount, or just the allowed amount, what insurance will cover. We can override any of these. We can give discounts if we want to, by percentage or by dollar amount. And once we scroll down, little note section that you can create templates for. At this point, most offices will save this as a draft after you've made your changes on notes and discounts and insurance coverage. We would save it in case the patient is still talking to the doctor or back in the operatory. Then when patient's ready to come up, we'll go to our drafts. We can do this on an iPad. That's the typical recommended. Then open this up on the iPad with all of your edits from before. Then the patient can sign it like this. Upon signing, 2 things happen. A copy gets saved for you in the document center like this. There it is. And a copy gets sent to the patient via email as a PDF with their own signature. That way we have a record of what was presented to the patient. Now, a few more things before we complete our procedures for today. We can put notes onto our recommendations, and we can put in the shade. We can say chipped while eating, things like that. That way, in case the patient does not end up scheduling this procedure today, if she were to call the office 6 months from now, a year from now, and ask for your front team to remind her why doctor recommended this procedure before she goes ahead and schedules it, instead of having to go read through all of the clinical notes from the past year, whoever picks up the phone can just hover over the pencil icon and very quickly tell the patient that you chipped this tooth while you were eating last year, and we would be doing your first crown on it because it got decay from that chip. And if she did want to do it today, then you can select the procedures, add it to today's visit. We're putting it into the actual appointment here, so it highlights it on the tooth chart to visually show that we're working on it today. And whoever is working from up front, if they happen to be looking at the schedule, they would see the procedure is now added to the appointment. So we'll flip over to the chart. We'll select the procedures on today's visit, complete on the bottom right. We'll make a new note as a new incident for today's visit. You can fill in the note here. We can add any additional notes that are written, and that number 21 crown, the initial placement carries all that, automatically copies and pastes itself into your clinical note later on when you complete the procedure as well. So it's like pre-writing your note in some ways. Once we save our clinical note, then the procedures are completed and they get sent over to the ledger. Before we flip over to there, let's wrap up our clinical overview with a look at the x-rays. So on the x-rays, we have intraoral series, bite wings, panos. There's an AI module that overlays your x-rays to show if there's caries, the measurements of any recession there. There's also the ability to import 3D images if that's something that you do in the practice. We can look at them like this. And if you receive anything from other offices, you can also import them directly into your imaging module here. Okay, let's go over to the ledger where we completed the procedures for today. We can create a claim that grabs everything we did today and send that electronically, which goes through our eClaims partner here. Then we have our claim of the procedures that are included in the claim. We can run a payment for the patient's copay today of $10.90.56, or if we didn't want to do the entire payment in one go, if the patient needs to split this up, then instead of doing your $10.90.56 at once, let's say we want to do half today, half next week. We can run it as a subscription and keep the patient's card on file to do 2 installments, and we'll do the next one next week as a courtesy for our patient. So we'll enter in the card number there. Okay. Once our procedures are posted, we would want to apply the payment toward what we did today. So this automatically allocates what we did and what we're paying toward. The surcharge amount, that's a receipt here, the surcharge amount shows up as well. So this is what the additional 3%, you would pass that on to the patient. That way the office doesn't have to pay the credit card processing fees. That's available per state. So if your state allows for you to do surcharging, and you can see a history of your subscriptions in the payments section. But before we leave here, we can send the patient a statement, which we can include the items from this past visit or just select a date range like this to make it nice and easy. We can show or hide different things that we want the patient to see or not see. And we can send this to the patient via text, email, or both. If we send it electronically, the patient also receives a link to fill out their credit card information and pay it online as well. So that increases your rate of collections and decreases the amount of time that you have to wait. So at the end of the day, let's go through and see our reports. We have a summary of what we did today, all of the transactions that were taken, payments that were posted, a summary by provider of gross and net production, gross and net collections, and your collections report or deposit slip of how much was collected today. We have our productivity report that shows from the beginning of the month to today what our production collections were trending, the contribution by provider and by procedure category. We have on hygiene what the goal was, how many were scheduled and versus completed, and a list of all the patients who do not have their next hygiene appointment scheduled yet. We can also look at our unscheduled treatment report and filter it out for procedures recommended within a certain time frame. We can specify if there's a certain procedure code we're looking for, and then select everybody in this list and make a group to send a mass emailing or text campaign to. If you were to want to do that, that would be under mass communications. You can look at the email templates that are available, customize them to your own liking, or tweak them for different procedure codes. You can make a campaign for all of your implant patients that haven't scheduled yet, or all of the ones that did Invisalign consults. These emails and texts can be sent to a certain group and scheduled to be sent out later or right away. We also have our ERA module for payments. So any insurance payment that gets received can be posted directly from the practice management software without going through a paper EOB and copying over the information by hand. All of the information is in here. The amounts paid by the insurance is also shown from the electronic version of the EOB, which is an ERA, electronic remittance advice, which minimizes the data entry errors and time spent copying over from a physical EOB or an EOB on the portal. Then there's also online scheduling, where you can select the types of appointments patients should be able to book and your availability by date. The online scheduling portal here is where patients will be able to book according to what types of appointments you allow. This can be put onto your Google Maps page, your Yelp page, website, all of that to increase patient bookings on your schedule, even when there's nobody available to answer the phone. And speaking of phone, Asprodental also has an integration with Mango for phones, where whenever a patient calls in, you'll have a pop-up on the screen of who that patient is, what their balance is, if they have any unscheduled treatment, and the rest of their family, if any of them have missing hygiene appointments or unscheduled treatment. The phone's integration also comes with AI voice summaries for all the conversations that you have with your patients. That was a very high-level overview of what Asprodental has to offer. If you would like to review the Asprodental workflow in more detail, tailored to your practice and how it operates, definitely reach out to us. We'd be happy to set aside the time and do a one-on-one with you, with your team. Just visit asprodental.com/demo to schedule that.